Hi, I'm Drew Redding. I'm the program therapist with Methodist Hospital Specialty in Transplant Behavioral Health Services, and I'd like to introduce you to one of the most effective tools we have in treating anxiety and depression, and that's mindfulness. At its core, mindfulness is the intentional act of paying attention to the moment with acceptance and without judgment. So with mindfulness, we can learn to start paying attention to our thoughts and our emotions, because these really drive the behaviors that we act on. Sometimes we just need to learn to tolerate a distressing thought and not react to it immediately. Maybe we want to choose how we respond to it. Let's say we're on a diet and we have a coworker who brought in some delicious cookies. It's fair that we might immediately think, I want to eat one of those cookies. And if we don't catch that thought, we're going to eat one or two before we catch ourselves. After that, what happens? We start to beat ourselves up for having this thought that's natural. You've had a cookie before. It was delicious and it filled you with joy. So it's understandable that you had that thought. But with mindfulness, we want to be able to catch those thoughts and be aware of them so we can respond to them. Let's say you wake up one day and you just don't have the energy to get out of bed. You feel like you're a failure. The day just can't go right. If we don't catch those thoughts, before we know it, we start acting on that and we start having a difficult day. Maybe we can learn to pay attention to those thoughts and not react to them so immediately, and we can choose how we respond to them. Maybe we recognize that there's a lot going on besides my desire to get out of bed. Maybe there's some anxiety or depressive symptoms that keep me in the bed that I'm not fully in control of. Mindfulness asks you to respond to those thoughts rather than react. Once we can pay attention to our thoughts and our emotions, then we have to learn to be in the moment. We have a lot of thoughts about our past and about our future that distract us from achieving what we want to today. So let's say you're staying in that same bed, you're thinking about all the other times you didn't get out of bed and all the other bad days you had. Maybe you start thinking about your future and how if you don't get out of bed today, you won't have your job tomorrow, or people are going to start putting you down because you had to call out one more time. If we can learn to recognize that those pasts have already happened and that future hasn't yet come, the only thing that really matters is what you're doing right now. Can you direct your attention to making the change that you want to see in this moment? Once we can start recognizing those emotions in the moment, maybe we can start accepting them as important and valid responses to what we have going on in our lives. Too often we think we should have a certain thought or we should have a different reaction, and I don't think that's fair for us. Maybe we can learn to accept that it's okay to have those thoughts about not wanting to get up out of bed. It doesn't mean we have to act on them. Maybe all we need to do is practice allowing ourselves to have those thoughts without reacting to them with judgment. Maybe we can just accept that we're doing the best we can. We spend a lot of time being judgmental of the thoughts that run through our head, but that's just what the brain does. It gives us a lot of things to think about. We don't have to act on all of them. Maybe we can ask ourselves the next time we're beating ourselves up or being self-critical, is that really helping you? Maybe it's not. Maybe we can learn to get out of our own way. It's okay to have these thoughts, but we really want to make sure that we choose which ones we act on. Mindfulness is an intentional act. We can tap into it on a daily basis. Maybe it's when you're driving down the highway singing to the radio. Maybe it's when you're trying to cook a new recipe, or even playing with your kids or your pets in the evening. Whatever it is, we can naturally do it, but can you learn to do it on purpose? Can you learn to pay attention to those thoughts in that moment without beating yourself up? I challenge you to practice mindfulness and take 1 minute out of your day to just sit and notice one thing, your breathing. Can you just notice it without changing it? Notice it coming in, going out. Is it fast? Is it slow? Is it deep or shallow? You probably find your mind wandering to other ideas, other thoughts. That's actually okay. Your brain's just doing what it's designed to do. But with mindfulness, we learn to bring our attention back to the thing we're focusing on. Can you bring your attention back to your breath? If we can just learn to pay attention to one thing at a time, we can really start to lessen the amount of stress we carry on ourselves day in and day out. As you practice mindfulness, I hope you find it to be a powerful tool to treat symptoms of depression, anxiety, and other mental health issues. It can be a tool to help us decrease our suffering increase our happiness and really help us focus in on the changes we want to make. There's a lot of great resources you can use, and I hope that these are some resources you can find helpful.